Welcome to the JOMA Preventative Health Podcast, hosted by the Jewish Orthodox Women's Medical Association. We provide you with up-to-date information on health topics geared towards the Orthodox Jewish community. This podcast content is provided for informational purposes only and is not intended as medical advice or as a substitute for the medical advice of a physician.
Welcome to the Jewish Orthodox Women's Medical Association, or JOMA podcast. I'm your host, Elisa Minkin. I'm a general pediatrician and proud JOMA member, and tonight I'm really honored and really excited to be interviewing Yonina Kaufman and Chumi Friedman from ATIME. Before I introduce them, if there are comments on this podcast, topics you want to hear, please reach out to us at health@joma.org. We want to hear from you. Yonina Kaufman specializes in helping women and couples who experienced a pregnant, perinatal and infant loss, infertility, and perinatal or postpartum mood and anxiety disorders. She is trained in maternal mental health, grief and bereavement, trauma, and parent training. While using evidence-based approaches, she is there to help clients untangle their thoughts and feelings while they go through their grieving, mourning, and or parenting journey. As the clinical coordinator for ATIME HUG is the separate branch of ATIME that is specifically for support for pregnancy loss. Yonina is fortunate to support women and couples experiencing perinatal and infant loss. In Yonina's private practice, she continues to do more of the same. Additionally, Yonina provides clinical supervision for therapists and social work interns, as well as conducts parenting classes for parents with children of all ages and stages. Chumi Friedman is the director of HUG, this program of ATIME supporting couples experiencing perinatal and infant loss. She is RTS trained and a certified chaplain. I will also add that obviously the topic of pregnancy loss is a very sensitive one and can be triggering for some people, so please take care. Welcome, Chumi, and welcome, Yonina. Thank you so much for joining me tonight.
Thank you. Thank you.
Yeah, this is a really important topic. And I will say that I met with Bronnie from ATIME way back when I first started the podcast. This was January of 2021. And I had done others on this topic. I met with, I did one with Amy Barron of I Was Supposed to Have a Baby. My colleague did one with a fertility specialist, but these were really more focused on infertility. So I want to start, those aren't really the same thing. We're talking tonight about pregnancy loss, and there's an overlap, obviously, but it's not the same thing. So I'm going to give you turns to talk so it's not so confusing. So I think I'm going to have maybe Chumi start and then Yonina chime in about the overlap, what's different about pregnancy loss versus infertility.
Okay, thank you. So I think the best way to explain the overlap is really to just give like 1 minute about ATIME, right? So when ATIME was founded 30 years ago now, it was because Bronnie and her husband were on this journey to build their family. And for part of that journey, she didn't get pregnant, right? So that's the infertility, right? There's another part of the family building journey, which is pregnancy loss. Usually it's miscarriages, right? And they came up against that a lot in their own journey. Bronnie had multiple losses. And then about 21 years ago, she delivered a stillborn baby. And just as she had felt alone at the beginning of her infertility journey, she felt that same aloneness now. And it was not just alone in the frum world, right? Sometimes we think that,
right,
we don't know how to deal with things. We don't know how to cope. But it wasn't.
Right.
People didn't know how to cope. Yeah, there were some organizations. And Bronnie always says, the doctors ran out of the room. They delivered the baby and they ran for their lives because they didn't know what to do with her. And she said a social worker walked in a few hours later and said, like, okay, so let's just talk about your pain. And Bronnie said, can you please get out? Like, I don't want to talk to you. And the social worker said to her, okay, but before I leave, could you just tell me on a scale of 1 to 10, how did I do? right? And then she said, which, and we're not going to get into all the halachos, but it was,
Right.
do I hold the baby? Do I see the baby? Am I allowed to hold the baby? Am I allowed to see the baby? How do I talk to my children?
Right.
How do I? And there was nobody. So they overlap in the sense that when you're dealing with couples who are infertile and are struggling with infertility, very often you will come up against loss. However, loss is universal.
Right.
And a woman can have 12 children at home, never experience infertility, and have had multiple losses. So I think that while infertility is definitely something that's very talked about now in our community, something that's very, very understood, because loss is so much more common, to a certain extent, it's even less understood.
I just want to say something before I give Yonina a chance, and that it hasn't been talked about a lot. And I think one thing is, from the outside, people may see, well, I just don't see a baby. Right. And that can be a different phases of loss. I want to give Yonina a chance to talk, because I think that there's, you talked about a late pregnancy loss, but there's also much more commonly what we call a miscarriage. So I'm going to give Yonina a chance to go through a little bit of that, please.
So hi, thank you again for having me, for having both of us here. We talk about, the loss. So what Chumi was really basically saying was that no matter what the gestation of the loss, right? We are really, I guess for 30 years, we're breaking down barriers of really understanding that a loss is something that needs to be acknowledged. And it needs to be really honored, right? Irrespective of when a woman experienced, whether it be an early term loss, a late term loss, a stillborn, and even when there's no confirmed, pregnancy beyond a home pregnancy test, right? We are still considering that is a loss, right?
Right. And I hate when they call it a chemical pregnancy, like it's not a real thing.
Right. Yeah.
Right. So from the clinical, I'll go from the clinical, right, perspective, the idea of when we talk about, grieving, right, when we talk about experiencing this loss. So Chumi and I, we talk about this often, is the idea that we're not only are we experiencing, let's say, the loss of an actual physical pregnancy, chemical, ectopic, early loss, miscarriages, stillborn, and in general, but we're also talking about the hopes and the dreams and the expectations and the vision of what this pregnancy meant to the woman and to the couple and to the family, right? And so we really need to give this space. And so thank you so much for giving us this opportunity to really talk about this, because as Chumi said, you talk about 30 years that we didn't acknowledge pregnancy, pregnancy loss. I'm telling you that we're breaking down barriers as we speak.
Right. Right. I actually listened to somebody called the miscarriage therapist. Have you heard of her? In preparation for this, because I needed something fast. And she's doing podcasts right now saying people aren't talking about this right now, 2023, in the secular world, forget the frum world.
And so, we're talking about it a lot more
than we used to, but not enough.
Not enough. And you mentioned the concept of, but I don't see a baby, right? It's the idea of when we don't see something, right? The message that has been for so long is, okay, it happens.
Right. Move on, try again.
Right? Move on, try again. And that's from you can also speak from the medical perspective, right? That's the message from the medical world. And we're recognizing and noticing that this is it's pervasive. It's impacting women and couples throughout their fertility journey. In regards when really recognizing, acknowledging that this loss is not just a physical loss of something, it's an emotional. It's so much bigger than just an actual physical loss.
Right. And if you go back to early miscarriages, I don't know if either one wants to talk about just how common they are.
So 1 out of every 4 pregnancies is a loss. not 1 out of every 4 women. People think that means 1 out of every 4 women. I've even seen posts that say, drive down the street and count 5. No, that's not what it means. It's 1 out of every 4 pregnancies. So the more pregnancies you have, the greater chance there's going to be a loss. That's just a fact of nature. I once heard a doctor describe it as if HaKadosh Baruch Hu, as if God wove loss into the fabric of creation. It is ancient. It is ancient. One of the 3 things that the Kohen Gadol, that the high priest prayed for on Yom Kippur, was that a woman should not have a miscarriage. Right. He prayed for rain. He prayed for things that affected the nation. And he prayed for this. We say this in our Yom Kippur davening. We ask for that. So it's incredibly common. So on the one hand, you would think if something was so common, we would be talking about it all the time because it's so common. And yet, because it is so common, there is a tendency to sort of like wave it away. Okay, it happened. No, I know it's so sad. Oh, it happened to me, or my mother, or my sister, my cousin, my friend. Okay, so what? And so there's a tendency to minimize it, especially the early loss, especially if no one saw you being pregnant. So then it becomes even like, what am I telling people for? I'm not pregnant anymore. What am I supposed to say? By the way, I was pregnant. By the way, no, I can't, participate in this meal chain. No, I can't drive carpool tomorrow. Why? Well, I had a miscarriage. So what? So did I. You can't do it. Because so many women feel that. And so they're dealing with something so common, and yet they feel so alone and so isolated because either they're afraid to speak up, they're afraid to make themselves vulnerable, they're afraid they'll be dismissed. I once had a woman tell me that her father said to her, okay, I know this is sad, but it's like getting back on the horse. You're just gonna have to try again. So as opposed to saying, I can't even imagine what you're going through. And that's all anybody wants.
Right. And I want to point out, though, that early pregnancy loss, you don't usually look pregnant. And it's very common not to talk about it. And especially if you've had a previous loss, you're not likely to, or if it's your, custom not to. And that means it was a secret to begin with.
You might not have even told anyone besides your husband.
Right.
You may not have told your mother. You may not have let him tell his mother. You may not have shared with anyone. And so now what? Now I'm supposed to share when it's over? What am I doing now? So I'm alone. I'm carrying this pain by myself. And it is pain. No matter how many children we have, it's still pain. It hurts.
Or how many weeks you got in, right?
Doesn't matter. I've had women reach out to me 5 weeks, 6 weeks. Like Yonina said, they took the pregnancy test and it was positive. They're devastated. They're devastated. And now what? So now what do? It's a very, very hard place.
Yeah, I want Yonina, can you tell us more about the healing process? I want to start with that, and then I want to go a little bit more into other situations. We're just starting with a regular miscarriage. I'm giving you a specific scenario. 1 miscarriage, first trimester. I'm just making that up.
Oh my gosh, that is as broad as it can get.
I want you to have a chance to talk, but I don't.
No, that's okay. We do this. We got this. As Chumi was saying, I had it recently. A woman in my community had a loss, and her very, very dear friend reached out to me and says, it's an interesting space. This woman has 7 children, and she had this loss. And she didn't understand. Like at first she was like, okay, I have 7 children at home. Like it was exciting. It was a bracha that I got pregnant, and it's okay. And then as a little bit of time went by, she couldn't understand what was coming up for her and how hard it was. And then it went even further than that. Her husband didn't understand why this was such a big deal for her, why she was so emotionally impacted by this loss. And so we'll talk about that in a minute, but I really just want to talk about so many different parts to the idea of healing. Healing is a little bit of a broad word. In order to heal, we have to acknowledge that we're actually hurting.
Right. I should have said grieving and healing, and that's actually the title. I'm sorry. That was my fault.
No, this is good. It's good.
I went right past the grieving, and when we're talking about how important it is.
Right. And so really, as C.S. Lewis, I'm going to just use a quick quote that he says, "No one ever told me that grief felt so like fear." Right.
Wow.
And so what is grief? Right. What is grieving? What is fear? Right. So much of when it comes to pregnancy loss, especially, it's so out of our control. Right. No one did anything to cause this pregnancy loss. This is it's the fear of the unknown. We don't know what happened. We don't know why it happened. We don't know what we're going through, what we're experiencing. It's so much. It's so overwhelming. And as Chumi just said,
but I'm going to say one thing, though, that I think that the flip side is to try to do that, right? Is to try to say, let me figure out what I did wrong. Let me figure out why this happened, right? I think it's a process just to get there, yes. Right? That's just to get to that point, to be able to say, and it doesn't mean you can't go to your doctor and figure out.
Oh, yes, 100%. So that's a little bit sense of control. That's trying to gain a little bit of sense of, what's going on, especially when there are so many feelings are coming up for us, when we're just trying to understand and rationalize, and there's a guilt that we just start to feel. And this is all common, right? Everything that you're saying, right? Just trying to as you said, figure out what the grief is, figure out what's coming up for us, figure out what we need in order to comfort ourselves. And we absolutely talk about advocating for ourselves, if that's something that we need to do in terms of going to our doctor, understanding, figuring out if there are tests that need to be done, having that advocacy and having that support from your medical component is tremendous, right? It's also connecting to the people who can hold space for this, right? So as Chumi just said, it's so lonely. No one knew. No one knows, right? There's no necessarily a ritual. We're not doing anything necessarily to commemorate this loss, especially as, when a child, obviously above, dies, right? We have rituals that are put into place to mourn, to honor. And so when it comes to pregnancy loss, right, it's not necessarily dictated to us as this is what we do.
Right.
Right. And so we have to figure out, again, there's no script to this. There's no rule book when it comes to recognizing that this loss was real. And I go back to this original story of this woman who experienced this loss after 7 children, because the bottom line is that loss is loss.
Right.
Right. And pain is pain. And her navigating this loss, she never experienced it before. She never experienced a traumatic experience, a trauma that she has to now navigate through, and how to communicate that to herself, how to communicate that to her spouse, how to reach out to the people that she needs in order to gain that support. And interestingly enough, she reached out to this particular friend. Why? Because she herself went through a loss, and it was a much later loss. And so everybody knew about it. And so she was willing to talk about it. And so this friend felt comfortable enough, felt safe enough to reach out to her, knowing that she would get that empathy, validation, and support, because this woman knew what it felt like. She had that experience. She understood that pain. And so acknowledging that feelings are coming up for us is just not, again, there's no steps here, right? But giving yourself that permission to recognize and acknowledge that whatever is coming up for you is real, it's valid, right? And giving yourself that self-compassion, giving yourself that space to recognize that whatever it is that's coming up, it needs to be felt.
Right. I want to bring up one more scenario, because I think that each scenario is different. I made it very broad, right? As if they're all the same, but they're not. I'm actually thinking of a piece that I read many years ago by Miriam, starts with an A. She's a therapist in Israel.
Miriam Adahan?
Adahan, thank you so much. And she wrote, I think it was the 8th candle, the 7th candle, which will forever remain unlit. And she was talking about her pregnancy loss for what would have been her last baby. And so I think that that's one specific scenario, that there's 2 things to grieve here, right?
Yes, very much so. Women who are, forgive me for using the term, older, right? But women who are getting closer to the age in which it becomes more difficult, right, to have a successful pregnancy, women in their 40s, right, mid-40s, that is really, really hard. I can't tell you the amount of times a woman has said to me, what if that was my last chance? What if I don't get pregnant again? And it's really, really hard. Really hard. So much about this is hard is because, like Yonina said, it's about not just the physical loss. It's about the hopes and the dreams and everything this pregnancy was going to mean, whether or not, and I think it's very, very important to address this even for just a couple of seconds, whether or not I wanted the baby when I found out I was pregnant. Because this comes up a tremendous amount, especially with the younger couples. Maybe they're married just a few months and she got pregnant. And for a split second or 10 seconds, or maybe even a day or two, she thought, really? It's not that I'm not happy I'm pregnant, because I know so many people don't get pregnant right away, but I thought I was going to have more time. I thought I was going to get to know my husband. I don't really know him so well yet. And I thought I was going to have that space. And then she gets excited, maybe, and she's thrilled. And a few weeks later, she miscarries. The guilt is overwhelming. And maybe I have 4 or 5 kids at home, and I got pregnant. And it's not that I wasn't happy, because it's a baby and it's a bracha, and why wouldn't I be happy? But everything in the house was going to change. My kids, what was I going to be doing? I was going to be shuffling around bedrooms, and what was going to be taking place when I have the baby? So much goes into our thought process when we find out we're pregnant. And so then when we lose that, we lose everything. We really lose everything. We've dreamed. Now it's gone. And I think that's the part that so many people just don't get. That loss of hope.
Right. And it's normal to have ambivalence, but then when something happens, it's so easy to blame yourself, when it, of course, is not.
But who else am I blaming? If it's not my fault, whose fault is it? I must have done it.
Right.
Either I thought it, or I lifted something heavy when I shouldn't have. Not because the doctor told me I shouldn't lift heavy things, but because, well, I moved the couch yesterday. Or I don't know whether it's women by nature. I don't know. We have this need to blame ourselves when something goes wrong. I'm a mother. It's my responsibility to take care of my children, and I failed. It must be my fault.
See, but emotions are not logical by definition, right?
No. And especially when the doctor can't tell us what went wrong.
Right.
I mean, even if he tells us what went wrong, it doesn't always help. But when I have nothing to pin this on, so then I don't know what to do. So on top of the grief, I'm anxious, I'm confused, I'm frustrated, maybe I'm angry at myself, right? There's another saying of, we used it last night, you said it, right? I sat with my anger for so long until she told me her name was Grief.
Oh, whoa.
I don't remember who said it, but we could look it up. And that's what it is, right? There's so much that's going on inside us. At the end of the day, it's grief. And we have to feel it. We have to acknowledge it. And we have to share it with somebody. You just can't hold it by yourself.
It makes so much sense. It really does. I'm going to give you another scenario, and the scenario is the fertility struggle and the pregnancy loss.
Yonina, you want to take that?
So, you made a comment as to why, women take on this. I'm noticing, and we're seeing it in different areas, but, women are naturally, most women are naturally nurturers, right? Our goal, our vision, our bodies naturally nurture a baby, right? And so when our body doesn't work the way it's supposed to. Right. It's the message that we're hearing. And I think the internal is coming a little bit also from the external. Right. You must have done something wrong. Right. It's that message from the external of like, really, what'd you do? What happened? Like, why'd that happen? And so we naturally we internalize that. Right. And we sort of sit with the idea of saying, I must have done something wrong, because it can't be that it just happened. Right. And that's what I was saying before. Right. The idea that, and that does require a lot of work. Right. To be able to recognize, to be able to sit with the idea that it's not necessarily something that we did wrong. There's not your body. It didn't fail. Right. That idea that our body failed us. And I don't minimize it. This is as common. These thought processes are common. Right. Because there are plenty of women who do get pregnant and have healthy babies. Right. We do see that it is a common occurrence. And so when our bodies don't work the way we had hoped it would, when our bodies are not doing what we thought, as Chumi said before, right? It is common, right? It does happen. But how often did we talk about miscarriage when we were growing up as women, as girls, as women, right? Did we talk about this? Is that a message that said this is something that is ingrained, that as Chumi said, it's intertwined into our biology? Right. And so it becomes such a shock for us. It's something that we can't grasp. It's something that's so overwhelming for us because it's not something that we even thought to prepare ourselves for. Right.
It's interesting. Yeah, it's interesting you say that, because when I listened to the miscarriage therapist, she was also saying that. Right. That she says, we don't talk about it. There's a book about pregnancy and they don't even have like maybe a paragraph about miscarriage. Like it's something that now doesn't happen to anybody. But what do we say? It happens in 1 in 4 pregnancies, 25% of pregnancies. And yet we don't give enough information about it. It's like we're afraid to say it or it might happen, but it does.
Yeah. What little girl plays house and loses a baby?
Right.
We don't do that, right? We play house and we have babies. That's what we do. And when you add the fertility piece, it's even worse.
Right. I mean,
my body is already failing.
You're bringing up the point of what to say to children when it happens in a family with children old enough, right? Because how you talk about, whether you talk about, these are complicated questions, really.
Very, very complicated questions. And there's no, I'm going to let Yonina jump in here, but there's no one answer for every family. For many families, it becomes, well, how do you navigate other difficult situations?
Right.
What do you tell your kids about other things that happen, right? Are you honest with them about everything? Or maybe they didn't know you were pregnant, right? Maybe you never discussed the pregnancy, which is incredibly common in some circles, even when the mother is showing.
Right.
Right? So if we didn't talk about it, then why are we talking about it now? Right? That being said, Yonina, I'm going to let you as the therapist answer this question.
It's interesting. I was telling my daughter tonight that I was doing this, and she says, why do you do this? You're a therapist. You work with women, with couples, but why do you do the teaching part? And I said, I looked at her and I said, because these conversations need to be had. And this is conversations that we need to start having. And so, yes, my family is a little bit more exposed to the idea of this world, because this is something that I feel very passionate about. And it is important for us as mothers, as talking to our daughters. But it doesn't necessarily, it's something that there's cultural norms. We have to keep that in mind of what people are comfortable talking about. You brought up the idea of talking to children, right? One thing that really came to my mind is the idea that not only are children, let's say they knew that their mother was expecting and the baby died, right? They're experiencing, they're navigating the grief of the loss. And what we also, I'd like to add, is the idea of also navigating the grief of who their parents are now while they're navigating their own pain. Right. And so seeing the children, holding space for the children, we get calls all the time about this. How do I nurture? How do I hold space for my children's pain while I'm going through this, and it's so hard for me.
But,
and if they did,
I'm sorry, I was just saying it's so hard because you don't want to give them your pain.
Right.
And how do you do that when you're in too much pain? How do you do it?
So there's, from a clinical perspective, I'll do it from there. I just want to acknowledge that everyone is experiencing their own pain. And I do want to come from all angles. Grief in and of itself, not everyone experiences grief the same, right? Grief is a universal concept, but how we translate grief, how we internalize and navigate this, right, and how we respond to it is very individual. So we will, we might assume that a child is grieving or we're grieving, and we look back and say, but I'm okay, right? And you question that, right? You say, I'm not hurting as much. I gave myself that space, and I'm really moving forward. I'm really moving through this. And some people may say that, and then they question, is that okay, right? So I do want to give space to the idea that it's so individualized, right? And so there's no right or wrong way to grieve. I just want to put that out there. I also do want to acknowledge that we have to take care of ourselves, right? So when we talk about the nurture, right, in order to give to others, we have to take care of ourselves, right? The idea of the plane, right? A mother has to put a mask on herself first in order to be able to give to the child. And so finding that space to take care of yourself so that you can take care of someone else, right? Creating those connections, finding the people that can hold space for you so that you can hold space for your children, right? If they feel that they need to speak to someone, connecting them with people that they could feel safe with, right? There are people who do understand it, whether it be a school counselor, whether it be giving. So not everyone is comfortable. I know that not everyone is comfortable being vulnerable and opening up what's going on at home. Right. And so it's gauging, right? If this is a conversation, if this is something that you're noticing in terms of your children, that they need that support, and you don't feel like you can be there for them because you're taking care of yourself, that's okay. We're here, right? Call ATIME. I could certainly say that we're here. We can help support you. We can help guide you and connect you with the right people. Right.
That's really terrific, because I think it's fair to say you don't have to be responsible for this. You deal with yourself. You'll get someone to help your child. It's not your job to moderate your child's pain and your own pain at the same time when you're suffering. You may not be able to, and that's okay. You can say that.
I think for most families, you can't. Whatever we're dealing with, it is really, really hard when you're going through a crisis to be able to hold everybody's pain.
Right.
We're not made to do that. And if you're the person who is directly experiencing it, you're not going to have the headspace to be able to hold your child's pain as well. You just can't.
Right. And that's fine.
Right. And that's what the support out there is for. That's what the referrals are for. It's interesting because I do tell parents when the child knows that there's a loss, right? I do tell parents, make sure somebody in school knows, because you're sending that kid off to school every day. And that's not fair. If you send him or her off basically alone, what are they doing? You have to tell somebody in school what happened. And I know it's hard. Who wants to pick up the phone and expose our vulnerability, right? Maybe no one else outside our family knew. And now I'm telling the school guidance counselor, I'm telling the principal. This is very uncomfortable.
Right. And then you're going to meet with people who don't talk about it even late in their pregnancy. And that's a whole separate situation because they weren't talking about it. So they don't have to talk about it.
Right.
But the child may be aware, but it may not be, by the way. If it's early in the pregnancy, the child may not be.
They may even be late in the pregnancy, and depending on the community, the child may not know.
Right.
I didn't believe that was possible, but it's true. My mother didn't know when her mother was giving birth. Like, some people carry small, like there are situations.
But sometimes you think your child doesn't know, but they too.
That's true too.
Right.
Yes. That's a whole other story, but yes.
Are there any books you recommend? I found one. I was very excited.
So it's a little bit hard.
What is
We once actually found one.
Mhm.
I can't remember what it's called. I have it on my desk.
Was it the string one with the string?
No, this was actually written from a from perspective.
Oh,
It was good. I really liked the book, except at the end, the mother has a baby. And I thought that just made it, that made it hard for me, to recommend the book, because it's promising a child something that we can't know is going to happen.
Right.
I would have been happier had it just ended with, the family being together and being quote unquote okay because they love each other, and as a family we're going to get through this, as opposed to we now close the door because there's a baby.
Right. And it's kind of like when you say to the person, don't worry, you'll be okay when you have
the baby.
Yeah.
Right.
And we need to talk about that. We need to talk about that, but I want to talk a little bit first about recurrent pregnancy loss, because that's a separate category.
Right. Yeah. So recurrent pregnancy loss is nowadays considered two losses already. It's considered recurrent pregnancy loss.
Oh, wow.
Yes, they will start doing testing already. Again, depending on the, individual situation, what the losses were, and recurrent pregnancy loss is really a whole other level of hard, because one loss, you figure out a way to navigate through it. Whether you're grieving, you're not grieving, whatever it is, you navigate through, and you can put it down to a fluke. It happens. Okay, I'm going to go through my grieving process. I'm going to okay, I'm shoring myself up and I'm trying again. And now what? Now I just lost it again. How am I supposed to try again? How do I do this? And let's say I do all the testing and everything comes back normal. So now what? Try again. Just try again. Sometimes it's easier if they find something wrong and they say, oh, we can fix it because that, right. But if there's just no, everything's normal. Why did it happen? I don't know.
Or there's multiple factors, right? You found one, you thought you were good and you weren't.
Or in so many cases, we don't find anything.
Right.
Or what we find really is not necessarily indicative of a loss, because half the population could have the same thing in their blood work and they're fine. And then it is just, so how do I do this now? How do I get up the courage to try again? And it's a struggle. I would never minimize and say it's easy.
Right. And I want to give Yonina a chance to give it from the therapist's perspective of what happens to a woman in this situation with her emotional health.
So let's just, the idea of the mental health, one loss could affect a woman's mental health. Multiple losses can impact a woman's mental health. The bottom line is, finding ways of taking care of yourself it's critical, right? What that looks like, obviously, is all relative, but the key of that, right, is really, Chumi, we were talking about this last night, actually. She says the question of how do you get up every day when a person is going through something so heavy, right? And, I'm going to throw out the concept of it's okay not to be okay, right? And so when we give ourselves that self-compassion, right? I'm just not okay today. That's okay. I need to take a break, whatever that break looks like, wherever you are, I need to take care of myself. We don't even talk about that, let alone, there are so many different topics, right, that we're now just starting to break open the idea of that we need to take care of ourselves, right? And sometimes putting ourselves in difficult situations over and over and over again, that may be something that's helpful to us. And that may give us a sense of purpose. It may give us something that's soothing, right? There are we have to commonalize whatever a person needs, whatever they're doing to take care of themselves, whatever they're doing to survive, right?
Right. What I'm thinking though is that with each recurrent pregnancy loss, that next pregnancy is going to be different.
Yes.
Right.
So
and that's kind of where I'm going in terms of, and even the idea of, the idea is, oh, when you're pregnant again, you'll be fine. Or when you have that baby, you'll be fine. And we need to talk about why that is not necessarily so.
So no, it's not necessarily so, right? The concept of anxiety, the concept of PTSD, the concept of trauma, we need to give space when a woman experiences, we are defining pregnancy loss as a traumatic event, right? And so when we actually use that definition, right? So because the idea of saying it happens, right? It's something that we're supposed to be, used to being able to just say, okay, move on, pick yourself up, brush yourself off and keep going, right? We're acknowledging clinically that that's not reality. We're not able to do it. We're not, it's impacting our every aspect of our being. And so when a woman is experiencing another pregnancy, right, the anxiety levels, they're very high. Right. And so I do want to give that space to acknowledging that sometimes you have the skills. Sometimes you really can pull it out of your back pocket of really just being able to de-escalate, really being able to talk yourself through it. Right. And if you have those tools, that's great. And if you don't have those tools, that's okay too. So connecting yourself with people, right, being able to help you learn those tools. Right? Not everyone is born knowing how to survive and go and move through trauma. Right? There's no rule book here. There's no you should have known how to get through this because ... No, right? We don't do that to ourselves. We can't do that to ourselves because it doesn't work.
Right. But even acknowledging this is normal. Okay. I've been through these traumas, maybe once, maybe twice, maybe 3 times. Each time I'm going to feel more anxiety, right? That's normal.
I once
just to say it, right?
To say it. You have to say it. I once had a woman say she had a loss. Okay, it was an early loss. So the next pregnancy, all she had to do in her mind was get past the week at which she had the loss, and then I'm good to go. And then she had another loss. Okay. So this time, all she needs to do is get past the time that she was at her second loss. But in this pregnancy, she lost the baby at almost full term. So what was she supposed to say the next time around? I won't be okay until I'm holding the baby in my arms. But even then, Baruch Hashem, she did. But even then, you're not okay. Woman once called me from her hospital bed, and she said to me, I can't stop crying. I'm holding the baby, and I can't stop crying. Why aren't I just happy? Because she was still mourning the baby that she lost. And she had been anxious the whole entire pregnancy, literally held on to every, and now it was all coming out. And so it wasn't that she was happy. She was happy. But there was so much. I actually did a webinar with Yonina and Dr. Norman Blumenthal on this. Why can't I just be happy? I had the baby. Why aren't I just happy? Because you've been through a trauma.
Right. I think that's the hardest thing for people to understand. They think that's why that ending of that story was so counterproductive.
Right. Yeah.
Right.
We can't just be happy.
And it has to be acknowledged, and it has to be acceptable to have those feelings. But I think that in general, women are supposed to be so happy when they have babies, even though we know postpartum depression and anxiety are so common, and they're higher in this population, I would guess. Right? The rate would be higher.
Yes.
And that you think it'd be lower because you think, oh, you should be so happy. You had even a harder road to your success, your baby in your arms. And then how do you accept that? How do you deal with it? How do you acknowledge and validate your feelings that are normal? How do you do it?
Yonina. Mm-hmm.
So I'm going to go one step further. One thing that we are hearing, right, and you just said it, right? I just need a baby in my arms, right? And so oftentimes the message that we give ourselves is the idea that if I just had a healthy baby, right, I'll be okay. And we are really, really recognizing and really giving the space of understanding that grief, right, has a space at the table, has a seat at the table, as much as the idea of wanting a healthy baby in your arms, right? And so oftentimes we don't even acknowledge the fact that we experience a loss, right? Because, okay, I went through the loss, now it's time to just get pregnant again. I have to keep going. I have to keep going. And that is a survival, right? It's a coping mechanism, and we don't minimize it. We are also really saying that we do need to acknowledge that loss, no matter what, right? And no matter what gestation, no matter where it happened, when it happened, how it happened, you need to honor that, right? And so one doesn't replace the other. And so one thing that we do talk about in terms of grief is the idea that when we give ourselves that acknowledgement, when we give ourselves the space and this permission to grieve, right? It actually does the opposite of what we think, right? So when the emotions are so heavy, right? We want to experience lighter emotions, right? When we think about a healthy baby, it's exciting, it's fun, it's something that everyone is looking forward to, right? So that it's something that's easier to hold, to think about, right? And pain is heavy, right? Fear, anxiety, all of these emotions, they don't sit well with us, right? It's not something that comes naturally to talk about. Death in and of itself isn't something that we naturally want to talk about, which is another conversation we will address, right? And so we don't want the feelings to come up. We sort of like push them down. We say, okay, I don't want to go there right now. I don't want to feel this right now. I want to just have this baby. Look, I'm expecting. Wait, I'm supposed to be excited. I'm supposed to be, I'm supposed to be supposed to, right? The idea of what it is that we're feeling. And so we often find that when we open up space for those heavier feelings, when we give it its acknowledgement, when we open it up, it actually does open up a space for our ability to experience and acknowledge another emotion, right? Because all feelings are valid.
Right.
All feelings come and go. They don't last, right? They come and go. And when you push down one emotion, I'm just going to put this out there, right? We say, oh, no, we're just pushing the ones that we don't feel comfortable with. But in reality, what we're doing is we're really pushing down all emotions, right? Because it's not possible to not feel one thing, but to feel another thing. Right? So we're literally internalizing, right? We're pushing it down, putting it somewhere, and not realizing that we've stored it. And so what Chumi was saying was like, here I have this healthy baby. Why am I not feeling exhilarated? Because we've been holding ourselves together for so long, right? We don't know how to experience and feel, right? Because we're not giving ourselves that permission to feel all feelings.
Right. I have a couple thoughts. One thought is, are we getting permission from outsiders? Because what's the expectation? This should be a happy time. And the other issue is that I think everybody else has a hard time dealing with difficult emotions and would rather deal with just, rainbows and bunnies and puppies.
Sure. Nobody likes to deal with somebody else's. We don't like to deal with our own difficult emotions.
Right.
So I'm supposed to hold space for you. Why can't you just be okay? Right? How many times is it, and we haven't talked about husbands yet, but
yeah, well, I want to talk about that. That was on my mind
how many
next.
times is the call from the husband who says, can we fix her? Like, can we just make her okay? Or it's the mother or the mother-in-law or the sister or the sister-in-law or the friend who says, we have to do something for her. Because we are, as a society, we are uncomfortable with other people's pain.
Right.
We want it to just go away. Can you just be okay now? Where's the Band-Aid? Can I put the Band-Aid on this? We don't have to see it. It's all covered up. And that just makes life easier for me. It doesn't make life easier for the person who's suffering.
Right. And that's where you get all the people saying the wrong things, I think. I think they really mean well, but they don't understand that it's their intolerance of your pain that leads them to say these things.
Or they give your pain a deadline. Like,
I'm done.
You can grieve for X. I've even had women say to me, Okay, so shouldn't I be over it by now? Like, over what?
Mm.
A dead baby? You don't get over that, right? And there's some sort of timeline. Like, somebody told you by X day, you have to be feeling this, whatever this is. So we can't make space for our own pain. We can't make space for someone else's pain.
Right.
We want it to be okay. We just want her to be okay, because that's going to make life better.
We need
That's
to talk
it.
about the dads. Yeah.
So the dads. I will tell you a very quick story, which I apologize, Yonina, because you've heard it many, many times. Phone rang one day at ATIME. He answered the phone, and the voice on the other end said, "Who's crazy, me or her?" "I don't know. Tell me your story, and I'll tell you who's crazy." So he says they're married very short time, just a few months maybe, I think it was. And she got pregnant, went to the doctor. They heard a heartbeat, and she started bleeding. They went back to the doctor. There's no heartbeat. The pregnancy's over. And he says to me, "And I'm okay." And she's sitting in the closet. So who's crazy? So I said to him, "Neither one of you are crazy.
Right.
You went to the doctor. There was a heartbeat. You said, yay." You went back to the doctor. There's no heartbeat. You said, okay. And she, from the moment she saw those positive lines on the pregnancy test, it took her 5 minutes to walk that child down to the chuppah.
Right.
So she's not mourning the yes and no. She's mourning 18 years that went by in the blink of an eye.
Right.
For many men, not all, for many men, pregnancy is not real, especially if she wasn't showing yet, right? If they didn't feel the baby kick, they didn't see the physical manifestations of the pregnancy, then for many men, it's just not real. And so when she has a loss, they just want her to be okay, right? They may not understand her grief, but even if they do understand her grief, they may be handling things completely different, because she's a woman, he's a man, she's one person, he's another person, and we handle things differently as human beings. Forget about the generalizations about the different way that men and women handle grief and trauma and all of that. Just we're individuals. With that being said, before I turn it over to Yonina, not all situations have the woman being the one grieving. I dealt with a couple at one point. She was okay. She said to me, I don't need your support. He does. Call him. He's the one who's falling apart. I'm okay. And to me, that was just fascinating. She felt very much he needs the support. She doesn't. So it's never always exactly the way we think it is.
There are men that may be grieving to a greater degree than women. I'm glad you said that, because I was gonna ask.
Yes, so they can. They 100%. For some fathers, everything is wrapped up in this baby. Everything. And then from one second to the next, the baby's gone. And he's grieving. And he may not be getting the support, because many people just assume that he's okay. I once had a father say to me, "It's all about her." He loved his wife very much. He said to me, "Even the muffins are about her." And I said, "What do you mean, even the muffins are about her?" He said, "People are sending over food to the house. It's so nice. Somebody brought over a whole plate of muffins this morning. It was addressed to her." He said, "Like, I'm not here? This wasn't my baby. It was just her baby." I said to me, why do people not see that I'm grieving?
Right.
When we talk about this a lot, they have to be seen. Someone has to ask them, "How are you doing? Tell me what's going on with you." Right? He may feel that his job is to take care of her. His job is to take care of the house. His job is to bury the... whatever he feels his job is. And in all of that, he may get lost.
Go even further than that. The idea that when it comes to this as couples, right, navigating this grieving journey, right? So let's say the woman might say, he doesn't hold space for me. He doesn't understand it. He's going through his own journey and I'm going through my own journey. And how can we together navigate this, right? And so truly understanding the nature. I want to just put that right. Everyone has different natures as to how they cope, how they navigate. And so granted, everyone, we don't like to generalize about anything, right? And so as each couple is navigating this individually, right? Communication is really just, I'm going to put that out there, is key. To be able to communicate, to be able to express. How often we've heard that, she can't hear me, right? We talked about it from the mother, from a parent to a child. But we also have this idea that when we're navigating something on our own, how can we hold space for what somebody else is feeling? And that is very much in terms of a couple, right? And so really, again, taking care of yourself, right? As well as being able to communicate what your needs are from your spouse, being able to say, this is what I need from you. You may not understand it. You may not see it from my eyes, what I'm navigating, what I'm going through. And this is what I need to get through this. Are you in a space to be able to do that? And so in order to give, we have to take care of ourselves, right?
Right.
And we also have to just sort of tapping into it, of recognizing what we need, right? So that's a big part. We may not even know, right? How often we have a woman who will say, he just doesn't get it, or he just doesn't do what I need him to do. And you'll say to her, what do you need? And she'll be like, I don't know.
I want him to know. I want him to know and just do it.
Right. I don't even know. And so it's hard for me to communicate.
But not everybody's equally capable of doing these things.
Yeah.
It's work.
Yeah.
Right.
And you should know, sometimes what she needs is to say to him, I need to hear how you're feeling, because I feel very alone in this. And I need to know, do you miss the baby? Like, are you sad? Are you grieving? And very often he is feeling all of those things, but he doesn't want to add to her burden because it's hard enough on her. Well, she needs my pain too. And so sometimes she needs to ask. She needs to say, please, can you tell me, even if you're not grieving, I can't be alone. So even if what you're telling me you think is going to hurt me, I still need to hear it.
But to be fair, all right, we're talking about everybody grieving differently.
Yes.
And men on the average may grieve more differently than women. So I think it's a fair answer to say, I don't want to talk about it.
That's fine.
And then
right.
what? And then what?
Okay. Right. Yonina, we talk about this all the time, that women, that we women, men, have a tendency to think that if I'm not getting everything I need from my spouse, it means there's something wrong with my marriage. And sometimes your spouse is just, whether male or female, your spouse is just not capable, doesn't have the skills to give you what you need. Okay.
And it might not even be the skills. I'm going to push it even further than that. It may be that that's what is too hard for them. That is what makes them worse. They function by not talking about something. Not everybody needs to talk through things.
Right. So that means you have to look someplace else. And it doesn't mean there's something wrong with your marriage. You haven't failed at something again. No, it's just your reality. Okay.
Right.
I can go further, not just in terms of that, and just piggybacking on that is the idea that to communicate, right, we need empathy, right? We want our emotions to be heard, when we want them to be validated. And so really communicating that, whether the spouse can understand it, whether the spouse agrees with it, whether a spouse connects with it, that too may not matter. right? Sometimes we just want to hear, I hear you. I'm sitting here with you. I may not get it. I may not understand exactly what you're going through, because you don't. You may not. You don't, right? But sometimes we just need to hear, I hear you, right? And so not everybody has that idea that to know, to give empathy, to be empathetic, right? We sort of sometimes just rationalize. We may not be comfortable with the emotions that are not necessarily comfortable, right? It may not be something that we want to even hold space for, right? So that, again, as a couple, again, I don't know, we did a webinar on couples navigating loss, because it's a conversation in and of itself. How couples navigate this from an individual. Again, remember, you're an individual. And I will say, just even the idea of, depending on where you are in terms of your relationship, right? Where you were before the loss in terms of your relationship, what the foundations were. If you were newly married, right? You don't even know each other, right? This has rocked the core of your marriage. And sometimes it really does strengthen, right? Learning those key concepts of communication, learning the key concepts of holding space, whether it's something we understand or not. The key concept of meeting the person with what they need, as opposed to assuming that they need what would comfort us. Right. So Chumi gives a story, right? That a husband used to bring tea. Am I using that story? The husband was it that story? So the husband constantly would bring tea to his wife, and she called Chumi. You could tell your story, but it really just resonated. I always think about it, right? The idea that, and she's like, why does he keep bringing tea?
She said to me, if he brings me another glass of tea, I'm going to throw up. And I said to her, wow, I hear you. And then I don't know what made me say it. I said to her, does your mother-in-law drink tea? And she said, yes. I said, does your father-in-law bring her tea? And she said, no, he would never do that. It's so not in his nature to be a giver. She's like, do you think that's what this is about? I said, listen, I don't know. I don't know your husband, but he's bringing you the tea. This is his way of expressing his love and his concern for you. He thinks he's helping you by bringing you the tea. You may want to have a conversation. I actually told her to take the love language quiz.
Right. I was going to think men are from women, men are from Mars, women are from Venus, and the love languages.
Right. I said, this may be helpful, but he thought he was doing the best. Clearly, he thought he was doing the best thing in the world, and she was losing her mind from him. So, but they were relatively, young couple, and still in that beginning stage, and they didn't have each other yet. Like, they didn't get it yet. They were growing. It was good.
Right.
Okay.
Right. I want to talk about the spectrum of support, say from what ATIME offers to the range of therapeutic options.
Okay. So we're very clear. We have Yonina, but we're not therapists. So ATIME offers peer support. But I think one of the most important things that we do is peer support. We have a 24-hour helpline, literally 24 hours. And everyone who takes our helpline, almost everyone who takes our helpline has been there and understands what loss is in some manner, shape, or form. But we do therapeutic referrals. Either somebody's calling us and saying, can you recommend a therapist? Or it's clear in the conversation. We're not doing this on our own. We can't. We need tools in our toolbox that we don't have.
Right.
So I think that's one of the most important things that we do is that helpline and those referrals. We also have an incredibly comforting packet that we send out, which, like, women tell me, it's getting a hug. It's saying somebody really cared. Somebody thought about what I would need in this space and is and is giving it to me. And we do monthly
Right. Let's make it
consult.
clear that this is HUG is the name of
HUG
the
is the name of
branch
our
of
program, yes.
ATIME for
pregnancy
support for pregnancy loss. Does it stand for something?
Hope, understanding, and guidance.
Hope, understanding, and
Guidance.
guidance. Very nice. Very nice.
Mhm.
I love it.
Yes.
What about the woman who says, I need couples therapy, but my husband won't come with me?
That happens a lot.
Yeah.
Happens a lot. I'm still going to make the referral, maybe not to a couples therapist, but why shouldn't she get the support that she needs?
Right.
She needs it. Why not? My only issue becomes when they call, when it's the husband who calls and says she needs therapy, or it's the mother who calls and says she needs therapy, and she doesn't want to go. She doesn't think she needs therapy. Okay.
Do you get calls about like postpartum depression, anxiety, and stuff like that
Sure.
too?
Yes. We refer them out.
Okay.
We'll talk to them, but we'll refer them out. And I would rather refer just if I smell it. Like, you know, I'm not 100% sure, but I suspect it. I'd rather refer and have the intake at one of those organizations say, no, it's not postpartum depression. I'd rather err on the side of caution, but yes, we do refer out for that for sure.
Right. That's good to hear. I have to say, you guys gave so much information and your organization is so amazing. And I'm so, so grateful that we were able to have this conversation. And thank you for reaching out to me.
Thank you. Thank you for doing this. I think that there's so much that we deal with on a regular basis that just needs to be talked about more and more and more. So.
Right. Right. We have to talk about it, and we are moving in the right direction. There's a long way to go, but we're moving in the right direction. And this conversation is one more step in that direction.
Thank you. Thank you so much.
Thank you so, so much.
Thanks for listening to the JOMA Preventative Health Podcast. If you've enjoyed this, please rate and review us on Apple Podcasts and share this with your friends. For more information, check out our Instagram at joma_org. Check out our website, www.joma.org, that's JOWMA.org, or email us at health@joma.org.